When I was going to medical school, the classic celiac disease was early onset, child who wasn't growing well, but that turns out now to be the tip of the iceberg. And as we can appreciate that, that's only a very small percentage of all the patients with celiac disease. And so other versions, other symptom manifestations are actually a lot more common than that, what we used to think as the classic presentation for celiac disease. And interestingly, the biggest group of all that's been found are people that don't yet have symptoms but have evidence for celiac disease by serology testing and then even by biopsies. So a large percentage of people have celiac disease but are not yet having symptoms. Late manifestations of GI symptoms is also an important part of celiac disease and actually is a bigger part than this classic picture. So similar kinds of things, diarrhea, but usually not so severe as it is in the smaller children, abdominal pain, abdominal distension, those are all things that can be seen with a later onset of celiac disease, which really can happen at any age. It can happen in adolescence, it can happen in adulthood, and even in older people far along in their life. And interestingly, a part of that spectrum is constipation, which is surprising to a lot of people because underlying celiac disease for almost all people is malabsorption. And people usually think of diarrhea as being a part of malabsorption, but just realize that celiac disease is an important it's an important disease to remember that you can have malabsorption, you can have important inflammation of the GI tract, but it presents with constipation. And then there's a lot of non-GI manifestations. And if I had the rest of the day, we would put the list of all of the things that have been described with celiac disease, but I'm going to hit a couple of the high points on these in this next couple of minutes. So one of the areas that gets involved a lot is the bones and the muscles, and especially with bones and mineralization. So osteoporosis, osteopenia is an important finding in people who have celiac disease. So there are a lot of people who've had difficulties throughout their lives with these problems and it hasn't been appreciated. They haven't been tested. And when they get tested and they get put on the diet, then a lot of these changes can be reversed. The skin and the mucous membranes, there's specific kinds of skin rashes that can be seen with celiac disease. And I tell the physicians that we deal with that if they have somebody who's a puzzle and they don't, and like having rashes and they don't know what's happening, or they're having sort of vague symptoms, they're not really sure what's causing it, to really think of celiac disease because it really is a great mimic. It can cause pretty much anything. Reproductive problems can be seen with celiac disease. I give talks in the community fairly often, and it's not unusual for me to have a woman come up, or sometimes more than one, who had great difficulty getting pregnant, and nobody ever tested for celiac disease, and then finally did, put on a gluten-free diet, and they were able to be fertile. So, as I said, it can cause many things, a lot of things we had never thought about even 20 years ago. And then from the standpoint of the blood system, it can affect the platelets, the white blood count. It can cause anemia, so there are important things that affect the blood system in celiac disease also. We're appreciating even more now the central nervous system and things like headaches, people with chronic headaches. That's something that's often been written off as what's called a functional disorder. There's no objective finding. We can't really find a disease. But in children, at least, we're finding a fair number with chronic headaches who have celiac disease. And so, again, a group that we hadn't thought of so much testing for before, but now feel much more strongly about testing for. And then these psychological problems, and the psychological problems that I'm alluding to now are sort of straightforward, I think, for a person with almost any kind of chronic illness. So this isn't something about the inflammation necessarily of celiac disease that would cause this kind of psychological problem, but the issues about being different, about having to be on a diet that not everybody else is on, about how do you deal with your friends, how do you do a sleepover of your child, how do you do a birthday party. So those kind of problems are very difficult ones for kids. And one of the commonest questions I get from kids is, what did I do? How did I cause this? You know, what did I do wrong? Was it that I sneaked some candy one night, or did I, something like that? So there's a lot of this part of education and support that we want to give, and for our program at Children's National, a very important part of our program is involving the psychological issues of celiac disease. And then I'll just tell you, almost any thing where you don't, almost any problem that you don't have an answer for, I think you'd be wrong not to test for celiac disease, because you got a 1 in 100 chance of finding it, because that's how common it is in the general population. But especially for people with chronic problems, I think that rate would go up really quite a bit. My final look at that iceberg, that tip of the iceberg, is like all the symptomatic people versus the asymptomatic people. And it turns out the asymptomatic people trump the symptomatic people by a ratio of about 6 or 7 to 1. So that's, and so how does it happen that people would get screened and they aren't having any symptoms? Well, it's often a family member, someone in the family who's got celiac disease, but the other family member doesn't have any symptoms at all. And then they've also done some population screening where they'll just get a group of people who will say, you know, I'll volunteer to give some blood, and again, to find those ratios, about 1% of people having celiac disease. Now, it's interesting, after those people get diagnosed, a lot of them say, well, you know, when I think about it, I've always had this sort of vague pain that I thought everybody had, or, you know, I've always had loose stools, but pretty much everybody has loose stools, don't they? So people get used to certain situations that aren't maybe so severe, but then when they get on a gluten-free diet, they can find really, I think, a very important improvement in their symptoms. And this idea of people who have celiac disease but don't yet have symptoms, so that's sometimes called silent celiac disease or potential celiac disease. We used to think celiac disease always started with inflammation early in life, but now it's becoming clearer that that trigger can happen later in life. So it doesn't always have to happen early in life. And we've had children that we've screened before who've been positive by antibody screening, and their biopsies are normal. And then if we follow them and then maybe biopsy them, and again at a later point, a few years later, then we have found kids who then have positive findings.